Welcome to The Pursuit of Health, the podcast for Americans with free choice in medicine. I'm your host, Reinier Schuur. Joining me back on the show is Dr. Colleen Smith to continue our discussion on rethinking American healthcare from a philosophically informed and pro-freedom perspective. Welcome back to the show, Colleen.
Thank you for having me, Ray.
In our last episode on this series, we discussed how it's a complete myth how America has a free market in healthcare. Now, why is that important? If we never had a free market in healthcare, then advocating for a free market in healthcare is something that we should fight for in the future, not something that we should go back to. But what we didn't address in our last episode is how should we think about the system that we currently have in American healthcare? In this episode, we will argue that we should think of American healthcare as being socialized. Not just now, but from its very inception. Now, we recognize that this is a pretty bold claim, and we will try to fully explain our view in this episode. But before doing that, let's just go into what people tend to think when people mention terms like socialized medicine. So, Colleen, in your experience, how do you think most people think about socialized medicine and what it is?
Most people, in my experience, think of socialized medicine as the quote unquote single payer system that has been talked about pretty frequently in the US in recent years. There are a lot of advocates both in and outside of medicine advocating for a single payer system. And it's this idea that government will manage payments for healthcare along the lines of what happens in the UK with the NHS or in Canada. In the US, my sense is that people tend to think of Medicare and Medicaid as aspects of socialized medicine. They tend to think of the VA as socialized medicine, but they think of people who get their medical care through health insurance or either employer sponsored or health insurance that they purchase on the Affordable Care Act marketplace. Those are considered private, non-socialized routes to obtaining healthcare.
And I think what's relevant there is that what you mentioned first is that people think of socialized medicine as being universal. And if that's the case, then America does not have socialized medicine. And you see this also in how free market think tanks and the AMA in the past have framed the American healthcare debate as fighting socialized medicine as something that's always in the future, right? Maybe it comes here in steps and bits with the passage of Medicare and Medicaid, with the VA, with the ACA, Obamacare. But complete socialized medicine is always something we have to fight in the future, not something that we have right now. Some think tanks might say like, okay, now we have it, but we didn't have it a few years ago. And that I think also frames, again, as we mentioned in the last episode, how people think about this whole thing is that reforming healthcare is about going back and avoiding what's coming in the future.
Right, going back to the time before Medicare and Medicaid, when there was a magical free market, supposedly of medicine.
Now, I think that there's something very unhelpful about this conceptualization of socialized medicine. But there are certainly relevant distinctions to be made. We can make a distinction between, for example, socialist medicine, where we want to organize medicine according to the principles of socialism, of each according to his ability, from each according to his need. But the other relevant aspect of socialist medicine and socialism in general is the use of force to arrange social relations. And socialism is just one particular way of arranging social relations. But the idea of using force to arrange social relationships, that has been the norm for most of human history. For most of human history, force has been used to arrange social relations towards some ideal or end, whether it's serving the nation or serving the king or serving God.
Or serving your guild.
Exactly. And in that sense, I think it's important to realize that while the ideals of socialism, in its explicit political form, of the dictatorship of the proletariat in Marxism, for example, if you want to go there, that might be new. But the idea that we want to use force to arrange human relations, that's always been the norm. And a related issue here is how people think about freedom and as a contrast to socialization, right? So for most of human history, people have had the concept of freedom, but freedom tended to mean something very different. Freedom would mean the freedom of my tribe versus your tribe, of not wanting to be ruled by a foreign king, but freedom means being ruled by one of our own. And in the case of socialism, it's the freedom of the proletariat to establish a dictatorship of the proletariat, right? And so the idea of freedom, of individual freedom, is something very new. And it's one of the purposes of this podcast to show that not only is that new in general, but it's new in medicine and it's not really been formed. And with that, we can now ask the question of this broader conceptualization of socialization. When did socialization in medicine start? Our view is that American healthcare has always been socialized. In the beginning, this was mainly done through the American Medical Association as a guild. They had all sorts of views of how healthcare relations should be had between doctors and patients. And this was large and in part viewed by their view of freedom, what freedom means for doctors, and what freedom meant for the AMA was to be free from market forces.
Ray, I'm glad you bring up the AMA. Most people today think that the AMA really doesn't have that much power. But back in the early 1900s, when the AMA started, the AMA really did wield a significant amount of power. They were able to work through state medical boards to remove licenses of physicians, particularly if those doctors didn't conform to their idea of freedom.
And I think that's relevant to point out because the power that the AMA wielded through the state medical boards, it wasn't just cultural power of, oh, like we define what it means to be a doctor. It was real political power. It was force. And you can see this by the fact that they would go after doctors who tried to set up group practices, which we covered in our last episode, um, or threatened to revoke their licenses. And just try practicing medicine without a license. You will go to jail. They will take you and put you in jail. So they really had the power of force on their side, and they used it to mold how they thought social relations should look like. Now, on the one hand, people might think, well, socialization, what that tends to look like, especially if we relate it to socialism, is bringing in a lot of people and collectivization, industrialization, right? That's what socialization and collectivization looked like in the USSR. But the AMA was advocating for this solo model of doctor and patient. Where's the socialization there? But while it's true that they had a more narrow conception of socialization, you might even think of it as an antisocial socialization, but it was socialization nonetheless. It was still a view that force is appropriate to arrange social relations. And the fact that they were against bringing in more people in the organization of medicine, that they wanted to protect the doctor-patient relationship as a solo individual relation, that's that's all that matters. And the fact that other forms of socialization wanted to bring in more people, it's still the view that, well, force should determine what this looks like. And the AMA was against people freely coming together, forming relationships, doctors and patients. Because again, it was based on the view that we cannot let people voluntarily decide what's good for them, and we need force in order to tell people how to interact in this space.
So, on the one hand, the AMA had spent years going after private doctors who were attempting to practice medicine in a way that did not fit with their ideal of the solo practitioner model. They used force to push these doctors out of medicine, to ostracize them, to take away their licenses. Then we enter the 1930s. The the US is in the waning throes of the Great Depression. Medical care is more expensive because there have been amazing changes in the technology of medication. We have new antibiotics. We have new ways of distributing antibiotics. We have new anesthetics that allow for longer operations and surgeries, and new surgical techniques are being developed. Patients want these medical interventions. They see that they'll make their lives better. Doctors want to use them, but they're expensive.
And the solo practice model was simply insufficient for providing these new technological innovations at scale. There was a real need for healthcare to scale, to industrialize, to become much more efficient. The group practice model provided one avenue to do that on a freer market, but the AMA shut the door on that future. That still didn't change the fact that healthcare needed to scale, needed to be industrialized. And the government recognized that need too. But given the fact that the door to the free market was closed, what happened after the AMA's attack on the group practice model was essentially a feud between the AMA and the federal government on what the socialization of American healthcare should look like. It was not a disagreement about using force to arrange social relations in medicine. It was a disagreement about what that relationship should look like under force.
And to clarify that a little more, it was not free market medicine a la the AMA versus government funded medicine. It was, how do we apply force to medical care? The way the AMA wants to, or the way the government does?
And what I think is really fascinating about this way of thinking about the process in which American healthcare was socialized is that at the very least, the government recognized the benefit of the group practice model, which was formed in the freer part of the healthcare market before the AMA shut it down. They recognized that free markets can achieve efficiencies at scale, which is why they wanted to use it as the basis to socialize American healthcare fully by imposing that model on everyone and using government funding to keep it efficient.
In fact, the AMA repeatedly defeated attempts by the government to institute socialized healthcare according to their model or the group practice model. They forced FDR's government to remove mention of socialized healthcare from the Social Security Act. They defeated Truman's plan to attempt to socialize healthcare. In that setting, healthcare was continuing to get more expensive and more technologically advanced. So some of that expense made sense. It would be expected. The AMA began to really feel a significant amount of pressure to come up with some other alternative way that healthcare could be funded, given that they had defeated multiple government attempts to fund healthcare, as well as private attempts to fund healthcare. Ultimately, what they came up with was what we will call the insurance company model. We've taken that name from Christy Ford Chapin, who coined the phrase in her book, Ensuring America's Health, the Public Creation of the Corporate Healthcare System, to give credit where it's due. This insurance company model was not real insurance. We can do an entirely separate episode on what real insurance is and why today's health insurance is not real health insurance.
What's relevant here is that this model, which the AMA called health insurance, is an AMA product where they stipulated four provisions. The details of provisions are not relevant for our discussion. What's relevant here is that it helped preserve the solo practice model as much as possible by separating the financing of healthcare from the provision of healthcare. So another way to think about this model that the AMA came up with is that on the one hand, they recognize the need to bring in third parties. You need some kind of corporatization in scaling up healthcare. But on the other hand, they wanted to preserve the solo practice model, and the insurance company model that they came up with was their compromise for keeping as much as the solo practice model as possible while bringing in third parties. Now, another thing that's relevant about this model is that basically everyone besides the AMA thought that this model was a terrible idea. And it was. And what's also relevant about this model is that it was not designed to be launched onto a free market and to compete with other models. This model was designed as a way to force people to interact, not with an eye towards efficiency and value creation, but with an eye towards protecting as much as possible the AMA's own vision of what it means for doctors to be free to interact with patients, which again we've covered before. They had this view that in order for them to be free, meant to be free from market forces.
So now we have these two models. We have the AMA's health insurance model that requires health insurance only to be used for doctors in this fee for service solo practitioner system. And separately, we have these government funded proposals for socialist models that conform a little bit more to the group practice model that was working and was the beginning of a free market change to healthcare before the AMA stamped them out. Which model won out?
Well, what's interesting here is that both models won out and neither won out, right? So the government's attempts to provide universal health insurance under the group model was defeated in two ways. First of all, the group practice model was not used as the basis to socialize medicine. And second of all, there was no universal provision. What there was, however, was socialized healthcare for the elderly under Medicare and for the poor and disabled under Medicaid. What also happened was the fact that the AMA's insurance company model became the basis for those programs. But not only that, it became the basis for all other forms of what's now called health insurance, which forms what people regard as the basis for the free market in healthcare, in American healthcare. Now, how did that happen? How did things get socialized in this way?
One reason I think this model stuck is that it began around the time period just before the Second World War when people were looking at communist Russia and they were afraid of communism and socialism. The AMA capitalized on those fears and convinced people that the government models were communism and they should be afraid of them, and that their health insurance model was quote unquote a voluntary system of healthcare, basically convincing people that their health insurance model was free market.
And it tapped into not only Americans' fear of communism and socialism, but their genuine respect for the free market as a feature, at least historically, of the American system. But what's relevant there is that this model did not come from the free market, unlike the government's own proposal to socialize medicine around the group practice model, which did come from the free market. And the model in question was designed specifically to maintain the solo practice model while still bringing in third parties, which means the model was ideologically based on the perspective that we should still keep doctors separate from third party financiers. Now, of course, they had to get involved, but what you had there is the separation between the financing of healthcare and the provision of healthcare, which is one of the main reasons why healthcare is so messed up in America.
Right. So then, Ray, what should we think about freedom if this is how we think about the system? If we're saying that every aspect of our healthcare system today is socialized, where do we go from here?
I'll say two things on that. First, a policy approach issue, and then a more philosophical point. On the policy level, what it should do for us is to orient ourselves around the fact that the very model that organizes American healthcare itself is a product of socialization. And for that reason, what it would mean to have real freedom in healthcare is not simply to introduce free market principles to make the health insurance company model a little more efficient. That's not what freedom looks like. What freedom would look like is the freedom for people to engage and experiment with different models, to have the freedom to pursue different models, to pursue different ways of interacting between doctors, patients, insurers, the pharma company, in new ways other than this model that we're all tied to. And this is relevant because the whole debate about how we should reform healthcare is around reforming this model, which
Right.
itself is socialized. But the other thing that we should be doing, and especially from the doctor side, is rethinking how doctors should think about freedom. And what we've seen throughout this whole series is that if the way that doctors think about freedom means the freedom to preserve the solo model, to preserve the doctor-patient relationship.
Or freedom from competition.
Yes, or freedom from competition. And that part of that freedom means using force to keep out better models and fearing that, oh, well, I'm going to be forced to join a group practice because they're better, right? Doctors need to rethink what it really means to have freedom in healthcare. And it should not involve the ability to impose a certain model on doctors or patients. But what it should also mean is a rejection of the premise of socialization, which is the view that force is appropriate and necessary to arrange social relations to meet certain social ends. And what freedom should require is the recognition that people have the ability and have the right to pursue relationships with other people voluntarily. Now, we can get into what that would look like on the policy level, what policies would get us into that direction, and we can do that for our next episode. But I think that's what our general orientation should be towards thinking about freedom.
Yes, Ray, I think all that is true, but we also have to consider what this would really mean for doctors and patients in practice. We really need to begin to think about what in practice it looks like for doctors and patients to trade with each other in a way that is free.
And that is certainly one of the main things that we want to do for future episodes in this series. And with that, I want to thank our audience, and until next time.
Till next time.
To stay up to date on our newest episodes, subscribe to our show from whatever podcast platform you are listening from. To support our show and Americans for Free Choice in Medicine, you can make a financial contribution at www.afcm.org/donate. Thank you for listening.